One of the most common surgeries in the country is knee replacement. The knees go on many of us, but there are solutions that are improving every year. Dr. Robert Cagle at Orthopaedic Specialists is here to talk about partial knee replacement compared to a total knee replacement. Are you doing more partials now, Doc?
It's growing, yes, it's definitely growing.
Why would I choose that, or for what reason, partial versus total?
Well, there's certain advantages to a partial knee replacement. So, you know, the whole mindset behind surgery is how can it be less invasive? So I want to do the most benefit for the patient with the least amount of harm to the patient. So if you only have part of your knee affected by arthritis, why do I have to do the whole knee replacement when I can just focus on where the pathology is?
That's good. So can you show me on one of the models here what would be an issue with a partial problem?
So this here is a model of basically a normal knee. This blue liner represents the cartilage that lines our knees. And that's basically smoother than ice on ice. So a normal knee bends and flexes like this. Well, sometimes the cartilage gets worn out. That is basically what arthritis is. And if only one compartment is affected.
So show the camera the compartments. Yeah, there you go, okay.
So if only one compartment is affected, here, or also the kneecap, there's 3 compartments to the knee.
Okay.
Well, if only one is affected and the other 2 are normal, we don't necessarily have to replace the entire knee.
But let's say I had a problem with one compartment, and so you replace that. But if I have arthritis, chances are I'm going to be affected in another part?
It's possible.
Down the line?
Yes.
Or okay, then you just fix that part.
Correct. Well, that's where it comes into your indications for surgery. So if you're made it to 75 years old and only one part of your knee is affected, there's a good chance that it's going to just stay there and you can do one surgery and be good for the rest of your life.
What if I'm 63 and I have one problem with one part of my knee?
Well, then it becomes a choice. So some people want to say, well, I still want to do the least invasive method, and if it fails in 10 years because now I get arthritis on the outside part of my knee, well, then you can convert me to a total knee replacement.
Okay. But if that's not for 10 years, until I'm in my mid-70s or 80s or whatever, okay.
Yeah, well, that's where it becomes a very personal discussion with the patient. So my philosophy on knee replacement surgery is I work for you. I'm your consultant. I give you information, and then you make the decision that best fits your life.
Okay. Well, that sounds reasonable to me. Has that not always been the protocol?
Sometimes, sometimes not.
Okay.
So
well, yeah, that's yours anyway. Show me total knee replacement then. That's this guy right here.
Yes. So this model here, so there's basically 3 compartments to the knee, and this is not part of the surgery, but just for demonstration to take the kneecap off.
Okay.
So you have the kneecap compartment, the outside compartment, and the inside compartment. And a total knee replaces everything.
You do all of that.
All of it.
Everything's okay. Is it all outpatient?
For most of my patients, yes. 80% of what I do now is done as an outpatient, meaning you go home same day, you're sleeping in your own bed the night of your surgery.
Even the total knee replacement?
Even the total knee, yeah.
Does partial knee replacement mean it will be an easier recovery, faster recovery?
It used to be, but now with robotics and how we've customized total knee replacement, there isn't as much an advantage as there used to be.
Okay.
But yes, I would say that the partial knee still has advantages as it is less invasive. There's less bone work that we're working on. So it does have maybe slightly faster recovery.
Okay. Well, what are we looking at here in the x-ray, Doc?
Yeah, so the x-ray there you can see on the one knee is not been touched. That's obviously just a normal. She does have some mild arthritis, but now if you're looking at the side view, that's the replaced knee of a partial knee replacement on the x-ray.
Okay. And what do you put in for a partial? What is that?
Well, it's an alloy of cobalt, chrome, some very durable metals, and then also a plastic bushing that goes between the metal, so that way it's not metal rubbing on metal.
And you really, I know a specialty of yours that you're very passionate about is the customization of this. My knee is different from some other person, right?
Correct,
We're all individuals with that.
Yeah, that's the power of the robotics, is the custom surgery that we can provide. And let's say, for instance, that you're hoping to get a partial knee replacement. When we get into surgery, and it's like with my eyes and actually look in through all the compartments of the knee, it's like, this doesn't really, I don't think this is going to give the patient what they want. I can literally flip a switch on the machine and then just do a total knee replacement. So that's typically the conversation we'll have before surgery.
You're going to tell me, if I see that, is it okay if we do the whole thing?
Yeah, for a game time decision, if I see something that makes me think that you'd be better suited for a total knee, would you like me to do that instead? So that's where I try to give the patient as much power in their decision making as possible.
Wow. Do you enjoy what you do?
I love it.
I could tell. You just love to replace knees and shoulders and hips. And
I love to see happy patients, and doing, curing them from arthritis makes people feel a lot better.
You know what? I'll bet your patients are growing as far as the numbers coming in, right?
I've been very blessed to be here in Quad Cities. So
well, we welcome you, Dr. Cagle. I know you've been here for, what, a year?
Almost a year.
Yeah.
I started seeing patients in April of last year.
There you go, a year ago. Orthopedic Specialists. Give them a call. And the consultation I know you're really serious about, so that's a good way to start.
Oh, definitely. Just come in and see us. We can get some x-rays right there on site, and then we'll discuss what best option suits you.
Great. Thank you, Dr. Cagle.
Oh, thank you.